Canada was slow to recognize the danger posed by radon gas, but since 2007, the Canadian government has taken positive steps to raise radon awareness, including lowering the Radon Action Guideline fourfold to 200 becquerels. Last year, Health Canada completed a 2-year cross-Canada indoor radon survey of 14,000 homes. The survey findings were recently published and resulted in Health Canada concluding that the population risk of radon-induced lung cancer is much higher than first thought, and that an estimated 16% of lung cancer deaths in Canada are attributable to indoor radon exposure. To put the current Radon Action Guideline into perspective, Dr. Bill Fields, who is a recognized leading world authority on radon, says that exposure to 150 becquerels per cubic meter per day of radon is equivalent of smoking a half pack of cigarettes a day. However, most Canadians today remain unaware of radon and the need to test their homes. In order to better understand and highlight the widespread presence of radon gas and to optimize the search for homes and schools with high radon concentrations and identify those areas of preventative action during new construction, a radon potential map can be an invaluable and essential tool. 2 years ago, we engaged a team of geologists and geoscientists to develop the first geologic radon potential map of Canada. The objective and purpose in publishing the map is to illustrate to Canadians the relative variation of radon risk across the country, and by doing so, increase public awareness and reduce the number of deaths caused by radon-induced lung cancer. We believe the absence of a radon map was a significant gap in the information available to Canadians and is an important tool to encourage testing in all regions of the country. The company based its core methodology on the US Geological Survey approach to the development of the geologic radon potential map of the United States. Several data sets common to both Canada and the US were identified, and their relationship to the 3 radon potential classes in the US was evaluated. Geology, geophysics, and geochemical survey information was available for both countries. Not all surveys covered all of Canada, but all of Canada was covered by at least one of the information types. Geological units form the basic framework for the Canadian radon potential map. It is the geology that largely controls the amount of uranium present in any given location, and therefore the radon. GIS processing was used to evaluate each rock unit contained in the geology dataset with respect to its US radon potential classification, its uranium geochemistry, and its radiometric geophysical response. These 3 major parameters were then used to classify the Canadian landmass. The geological base for the analysis and production of the Canadian map is the database of the Geologic Map of North America. The North American map includes some 29,000 individual map polygons describing the distribution of approximately 690 map units. The Canadian subset of this geology database contains some 13,000 map polygons and describes the positions of approximately 450 geological map units. The framework for the Canadian map is the geology polygons contained in the Geology of North America map. During the pre-processing stage, all of the geological units found in the United States were assigned a radon potential value by overlaying the polygons on the published USGS radon potential map. All of the units found in Canada had this radon potential value added to their parameters, hence extrapolating the radon potential of US geology into Canada. To classify the polygons into the three desired classes, a set of rules was required to define how the various data sets contribute to the final ranking. As can be seen from this picture, the US radon potential maps divided the lower 48 states into three distinct classes, each representing about 1/3 of the land area. In order to show the relative radon risk across the Canadian landmass, the same geographical area proportions were the objective for the Canadian map. The resultant proportion of polygons falling into each radon risk category in Canada was high, 25%, moderate or elevated, 29%, and low, approximately 46% of the landmass. The final step was to select messaging to accompany the map that would best illustrate radon as a national hazard and reinforce the need to test across the country regardless of zone. To accomplish this challenge, firstly, we defined the risk in each zone as relative, reading out references to predictive average readings. Secondly, we further defined the three zones by a corresponding human alert level. And last but not least, we highlighted and reinforced the need to test regardless of region or zone. The completed map now allows radon risks to be better assessed and predicted over the extensive Canadian landmass. To recap for a moment and summarise, Canada's first radon potential map is based on data obtained by accepted protocols and properly designed geographical-based surveys, and was created by a team of experienced professional geologists and geoscientists, all of whom formerly worked for the federal or provincial geological surveys of Canada. Once our radon potential map of Canada was finalised, we decided to see how well the Canadian and US maps could be integrated to create a continental picture. Not too surprisingly, regardless of the actual geographical borders between the two countries, the geology is a seamless fit. The North American picture is quite striking from a geological perspective, where it is possible to see the glacial movement over thousands of years, which has transported uranium-rich rocks and soils into the upper United States. Uranium is present in all rock types to some degree, and is much more concentrated in uranium-rich deposits, as depicted by the blue dots in this picture. Materials deposited on the Canadian landmass constitute its surficial cover. This feature was utilised in the radon potential map construction of the US, as cover plays a significant role in radon prediction. Relating surficial cover to surficial deposits, glaciers are effective in redistributing uranium-rich rocks from bedrock and uranium-enriched deposits. Regions with thick surficial glacial cover have the potential to host high levels of radon when they are travelling over exposed uranium deposits, such as those found in Precambrian granites and metamorphic rocks of the Canadian Shield and Black Shales. These data sets and any other new geological data that becomes available for Canada will be included in future editions of the Canadian Radon Potential Map. When geography is overlaid on the Canadian Radon Potential Base Map, it is clear that large areas of the Canadian landmass, and importantly, many centres of high population density and land use reside in high or elevated radon potential zones. What implications might this picture have for our homes and schools and workplaces, or where and how we grow our food and obtain our water supply? Canada is also a major producer of food fertilizers from phosphate rock, which naturally contains high concentrations of uranium. Another consideration is the possible uranium contamination of common building materials, such as cement aggregate and granite, which could be a source of radon brought into our homes from other geographic regions of the country. Also, what influence might our extreme Canadian climate be playing on radon movements in the winter into homes and buildings in high radon potential zones, such as Eastern Canada, the Midwest provinces, and Northwest Territories? As can be seen from this picture, significant potential radon hotspots can be found in every province from coast to coast, and in and around some of Canada's major provincial cities, such as Calgary, Toronto, and Ottawa. The underlying geology of glaciers in eastern and southern Ontario is a source of the high radon potential in the Ottawa area. Having personally lived in basement homes in the Ottawa region between 1980 and 1995, I wish that someone would have shown me this picture back then, as I would most certainly have tested my home for radon gas. Unfortunately, this information was not available to the public at that time. And 3 years ago, my wife, who has never smoked, was diagnosed with lung cancer and underwent surgery to remove tumours in both her lungs. We now know that Janet's lung cancer was almost certainly radon-induced and likely could have been prevented had we known to test and mitigate our home for radon gas at that time. Canadians have a right and need to know about the dangers of radon. The potential impact on select populations across the country is significant and clearly visible. One example of this is First Nations communities, many of which in Canada are situated in potential radon hotspots, as illustrated by this picture. This situation was recently highlighted as part of Health Canada's National Radon Programme, when testing was conducted on the Tobique First Nation Reserve, which lies within an elevated radon potential zone in the Atlantic province of New Brunswick. 6 public buildings were tested, and 5 of them, including the community's daycare, healing lodge and wellness centre, showed elevated levels of radon, and subsequent testing of homes on the reserve produced similar alarming results. Building on our national radon potential map, we are generating radon maps for each of the provinces and territories, which will assist health regions, school districts, and municipalities to develop and focus their radon risk strategies. This also makes financial sense, as the regions of the country in high-risk zones can be targeted, making the best use of scarce resources. As I mentioned earlier, radon is still a relatively uncommon topic in health and science debates in Canada, which is alarming given the serious public and occupational health hazard that radon gas poses to Canadians. Despite Health Canada's positive radon initiatives, raising public awareness is costly and takes time, and government cannot be expected to do this alone. Our latest mapping project has us very excited. We have now taken the radon potential map of Canada into an online and interactive format. We have developed a program that's robust for professionals and yet simple to use for the general public, and a user can now access the map from both their computer and handheld device for a very low and affordable cost. Many of the features on the desktop version are customizable, providing access to underlying data values like the ranking data, uranium geochemistry, and bedrock type that are part of the map construction. Users can also view overlays of additional data, such as uranium and thorium deposits, the First Nations communities, and population per square kilometre. The desktop version is highly interactive, and to make the map available on all platforms and mobile devices, we have developed an additional mobile website. The mobile version is simple and straightforward, and with a single click or tap, users can zoom to their current location. The official launch of the interactive map will take place later this month, so stay connected for updates through our weekly Radon newsletter and website at radoncorp.com. As in the US and Europe, it will take collaboration between the private sector, government and non-government organizations and associations like the Canadian Association of Radon Scientists and Technologists, which was recently formed last year, to effectively communicate this important health warning to all Canadians. The World Health Organization, in its 2009 handbook on indoor radon, stated that radon maps can be a useful tool in implementing national radon policy and to target resources to radon-prone areas, rather than as an indicator of areas where testing is not needed. Furthermore, in a 2005 survey of 20 European countries conducting radon mapping, over 35% of government organizations use private consultants like Radon Environmental, with the appropriate experience in geological mapping techniques to produce a national radon potential map. We believe that mapping the geologic radon potential of Canada was an essential and successful initiative and provides a sound base to which new data can now be added. In conclusion, Canada now has a radon potential map, similar to the published maps available for the United States and other countries around the world. And before closing, I would like to acknowledge our team of professional geologists and geoscientists, without whose mapping skills this picture would not have been possible to create. I'd also like to acknowledge and thank our creative designer and communication manager, Alana McFarlane, who is here with me today, and who has made a major contribution to our map designs and this presentation today. I hope in the short time available, I have articulated how and why Radon Environmental took the initiative to develop the first radon potential map for Canada. In closing, I'd also like to thank the UBC School of Population and Public Health for inviting us to make this presentation in their seminar series, and I'd be happy to field any questions. Thank you.
Hi, great presentation. Just out of curiosity, you might have mentioned this, maybe I missed it. What's the precision on the map? Like to what level do you have a resolution? Like if you're going to look at your home versus someone else's home? Because sometimes radon can change with, you know, the exposure from across the street from you. So I'm just wondering.
No, that's a great question. The map, as I mentioned earlier, is meant to provide a relative picture. So you've got to be careful if you zoom in too closely on an area, because the number of data sets, data points, is obviously not as relevant. And the other factor to consider is that there are many other parameters that affect the movement of radon into any given home. So the nature of the construction of the building, particularly the slab, if it has a slab, together with other atmospheric considerations, air pressure, temperature, climate, all of those will affect the movement of radon into a home. So you can't just take a geologic map and try to use it as an absolute measure of where you might find radon. It's meant to be viewed relatively, but it is the best predictor of where you might find high radon potential zones. But you've got to be careful of the scale that you try and drill down to, and it's only as good as the number of data sets and data points that you have.
Hello, Alan. I'm Anne-Marie. I'm the Executive Director of CareX Canada, and we've been collaborating a little bit back and forth. So I was very excited to hear that you came today to talk to people about radon and your map. I'd like to ask you a few questions about correlations between the maps that you developed and the ones that we developed with Health Canada's building data, and whether or not you've attempted to look at if the radon potential correlates to some of the measurements that were done in people's homes.
Yes, yeah, no, that's another good question. The Health Canada data, we've been, the indoor data, which is what you're talking about, Anne-Marie, is something that we've been talking with Health Canada about, and we hope to be able to present as an overlay to this map so that you could see very clearly where the relationships are. That hasn't happened yet because Health Canada is still trying to determine how best to make that data publicly available. It's from a privacy point of view. They're nervous of doing that before they get the necessary approvals. So at the moment it's based on the information that's out there in the public.